hazards of the job is while you're searching, getting poked by a needle, and it happens more frequently than you think.
The head of the Correctional Officers Union plans to tour Canada's first supervised consumption site inside of a prison. While the union is pushing for the service to be expanded to all institutions in the country, those fighting back say they won't be as effective as supervised consumption sites like this.
This is actually a really dangerous game of bait and switch. This is a suggestion that there is support for harm reduction services, but it's actually being used to try to prevent the implementation of a needle exchange program.
Since opening June 24th at the Drumheller Institution in southern Alberta, 9 inmates have signed up for the overdose prevention service, staffed by Corrections Services Canada healthcare workers who provide needles and monitor for signs of an overdose. Corrections officers argue it's safer than the needle exchange program that's offered in 6 federal prisons in the country.
With that, the inmates have the ability to share needles back and forth with other inmates on their range. And to us really does nothing to control the spread of infectious disease and increases harm for our membership.
This supervised consumption site here in Calgary had over 4,500 instances of drug use during visits in June. But even those who support sites like that say it doesn't work the same in prison, where people can face criminal charges.
It's obviously pretty much impossible to basically preserve your confidentiality when you're trying to gain access to that health service. So you're basically outing yourself as engaging in behavior that is prohibited.
The group is part of a lawsuit arguing Corrections Canada isn't providing adequate health care through a needle exchange program. Corrections rolled out the service last year, but on Prisoners' Justice Day on August 9th, the legal network argued it also has issues that's keeping inmates from accessing the service.
So whatever happens to their health while they're in prison actually has downstream implications for the health of the communities to which they return.
In Calgary, Crystal Adaris, City News.